So seizures are periods of altered brain function due to reoccurring abnormal electrical impulses, and they can be caused by numerous things. They could be caused by trauma, infections, toxins, metabolic factors like diabetes, or they could be idiopathic, which means we don't know why they have them. They're characterized by loss of consciousness, increased muscle tone and movement, altered sensations. So something called status epilepticus is a rapid succession of seizures, and it needs to be treated as an emergency. And usually we treat it with pentobarbital or other medications. So 90% of treatment of seizures is client education. So you need to inform the client that seizures are controlled, they're not cured. You need to reassure them that they are not painful. If the seizure lasts more than 5 minutes, then they need to call the vet. And medication will likely cause urination and excessive drinking. The other thing you need to let them know is that medication should never be stopped suddenly, and even when they're switching the meds, the dose should be reduced gradually, and that's the way they can avoid inducing seizures. Anticonvulsants are drugs that help prevent seizures. And when taken prophylactically, we want to make sure that we're obtaining the greatest degree of control over the seizures without causing side effects. So there are several different kinds. They're usually classified as CNS depressants. They all have the potential of causing excessive urination and drinking, ataxia, drowsiness, and hepatic toxicity. The clinical effects are used as a guideline in therapy, and normally we divide the doses into BID, TID, or QID. If you do them TID or QID, they have better control of seizures. And usually the higher doses are given at night when seizures are most prone. So DIAZEPAM is probably the biggest substance that's used to treat status epilepticus, or when they're having a seizure. And it works by increasing GABA, which is a substance that inhibits the impulse transmission in the nerve cells. It can be given IV, intrarectally, or nasally. And they use these to get the seizures under control, and then they switch the animal to an anticonvulsive. PHENOBARBITAL, this is the most commonly used oral anticonvulsant. It's a long-acting barbiturate. It is a C4. It's a controlled substance. It can be given orally, though sometimes they have it as intravenous, so this isn't very often. Animals do develop a tolerance, and you must increase the dose accordingly. So then there's pentobarbital. This actually is no longer available on the market. This is a short-acting barbiturate. It's given IV. It's good for seizures caused by toxins, and it is a control too. So normally seizure control started with, we use diazepam, and then we move on to phenobarbital to prevent further seizures, and then we have some add-on drugs. So one of the add-on drugs is potassium bromide. You can sprinkle it on the food or give it PO. It is an adjunct of therapy. It can cause electrolyte imbalances. It usually needs to be compounded. Side effects of potassium bromide are electrolyte imbalance and vomiting. So GABAPENTIN, this is another therapy for refractory seizures. These are seizures that happen when we don't know why they're having seizures. It goes into effect, it's least effective when we compare it to other adjunct therapies. They also use gabapentin for pain management, though it can cause problems with liver. So zonisamide, this is an oral add-on anticonvulsive. It facilitates dopamine and serotonin neurotransmission. Its half-life is 15 hours, so you can do it BID. You can give this interrectally for status epilepticus, and side effects are sedation and ataxia. And then we have Keppra. This is also an oral add-on. It is 100% bioavailable, and it is not metabolized by the liver, which makes this a more valuable drug to use if an animal has hepatic toxicity. So that is what we need to talk about for anticonvulsants.